The first group of patients that we're going to talk about are those who have inherited face and neck features that they might want to change. So the first problem that people often come to see us about are fatty deposits underneath the neck. So that can be treated with simple neck liposuction. So in this patient, she has some extra fat in the submental area. So her neck angle is actually more obtuse, so it's a larger neck angle. It's probably 130 or 140 degrees. And we'd like to sharpen that up a little bit by removing some of that fat that sits underneath the neck. Now in her case, we also advanced her chin a little bit with the chin implant. We'll talk about that a little bit later. So let's talk a little bit about the ideal neck. What we like to see is a fairly sharp demarcation between the vertical and the horizontal part of the neck. And the ideal angle is probably somewhere between 105 and 120 degrees. In the case of extra fat in the submental area, essentially what that does is it pushes down the horizontal part of the neck and makes that angle more obtuse. So it might be 130 or 140 degrees. So it doesn't make the neck look particularly sharp. When we remove that fat, of course, it sharpens up the neck and makes the horizontal part of the neck appear a little bit longer. So let's look at this neck. There is a little bit of extra submental fat, and what that's doing is that's making her mento-cervical angle a little bit too acute. So we'd like that to be sharpened if possible. There's no real signs of aging otherwise. The jawline is normal. There's no lax skin. There's no jowl formation. So I think this is an example of a situation where removing the fat is probably all that's necessary. So liposuction is done through a small incision that's made in the submental area. So many patients will have a crease there that's naturally forming. We'll make a small incision that's 2 or 3 millimeters in length, and that'll allow for access with our liposuction cannulas underneath the skin. So the fat is sitting on top of her platysma muscle but underneath the skin, and that's gently liposuction with a very small liposuction cannula through that one incision. Once the procedure is finished, sometimes that incision needs to be closed with a small stitch, but often it's so small that it doesn't even require a closure. So in the example on the left, with a patient who just has fat in the submental area, right in the midline, an incision in the midline is all that's necessary. If there's also fat in the lateral parts of the neck as well, then it's helpful to put a small incision just at the base of the earlobe to allow access again to that area with small liposuction cannulas. In our last patient, because she needs advancement of her chin as well, I'll have to extend the submental incision so that it's big enough for me to insert a chin implant. So what I do in this situation is make a slightly longer incision that allows me access to the chin area. Now I can still do liposuction in the neck with that, but it also allows me to, at the same time, to place a chin implant to project the chin forward. These are the steps for neck liposuction. A local anesthetic is used to anesthetize the skin. So a very small 2 millimeter incision is placed underneath the chin, and then tumescent anesthetic solution is infused into the neck fat. And what that does is it provides anesthesia and also vasoconstriction, so there's almost no blood loss when we do a liposuction procedure. Small cannulas are then used through the incision, and these are very tiny tubes with perforations at the end of them. And we put a vacuum on that so that when we pass the cannula through the tissues, it essentially vacuums the fat up. Once that's done, a pressure garment is worn for usually 1 to 3 weeks, depending on the situation. What to expect for recovery from liposuction or from liposuction with chin augmentation is a recovery period of about a week. It's very important, particularly with the liposuction, that a pressure garment be worn. The pressure garment essentially helps to support the skin that no longer is being puffed out by that extra fat that was there. So what we want to do is we want to try and have that skin contract upwards by using a pressure garment. We ask that our patients wear that as much as they can for a period of about 3 weeks. The incision that we make, either longer or shorter, depending on whether they require a chin implant, heals extremely well, and it's closed with dissolvable stitches. There's not really much maintenance involved. They dissolve on their own, other than just putting a bit of polysporin onto the incision. Most people will have some swelling and bruising for about a week from both the liposuction and from the chin augmentation surgery. I think in most cases the augmentation is probably more initially because of that swelling, so that swelling subsides over a period of 2 to 3 weeks, and then the final results are fairly evident. When is liposuction not an ideal procedure? There's 3 main situations. One is when there's significant lax skin, if the patient has prominent jowls, or if the skin is particularly thin. In the case of excess neck skin, The problem with liposuction is that we're removing some of the fat that is bulging the skin forward. So when we remove the fat and don't remove the excess skin, then there's still the extra lax skin that is hanging down in the submental area. So depending on the person's age, if there's lax skin preoperatively, then we don't usually recommend liposuction on its own. In the situation where patients have jowl formation, again, it's an indication that the neck skin is probably sagging already and that there's extra neck skin. And I think when we do liposuction, it may rejuvenate the lower parts of the neck, but doesn't rejuvenate the jowl. And I think in those situations, there's a bit of an incongruity between the rejuvenated neck and then the age-related changes that you see from the jowls. So probably not ideal in someone who has prominent jowls as well. The problem with thin skin is that sometimes it doesn't camouflage what we've done surgically, so there can be some irregularities that can be seen through the skin after liposuction. So in patients with really thin skin, I don't usually recommend it. So whenever I'm evaluating someone's neck, I'm always thinking about the risk-reward trade-off. So in this situation, what's nice about liposuction is that they do remove some of that extra fat that contributes to a poor neckline. The risk of the liposuction is that it may remove the extra fat, but leave someone with a little bit of extra skin there if that's not dealt with. The other risk is sometimes you can get some irregularities that form in the area that was liposuctioned. So what we aim to do when thinking about the risk-reward trade-off is try and choose a procedure that is the least invasive, that will have the quickest recovery time, but will also give the patient a pleasing and appreciable result. In this situation, I think liposuction and chin augmentation for this patient was ideal. Quick recovery, it really dealt with the problems that she had in particular, and we didn't do additional surgery that she didn't need. When looking at the spectrum of face and neck surgeries that we perform, liposuction is really on the low end of the invasiveness or in terms of recovery time. It probably has a limited use in that it's for patients who just have extra fat or who have a recessive chin. But recovery time is very quick. It's a very low risk procedure. And I think most patients are back to work or school very quickly. So it's nice in that sense. So now we'll just have a look at the results. Again, this is a patient who's quite young. She's in her 20s. She had some extra fat underneath the chin and a poorly projecting chin. So what we've done is liposuction the fat out from the neck and then advanced her chin with a medium-sized chin implant. And so this is her results after. Much nicer mento cervical angle. She now has a much longer horizontal portion to her neck, and her chin is lined up nicely with her forehead, and that's about appropriate.